So welcome everybody to the Roadmap to Reopening webinar. My name's Debs McCann and I'm Woodcraft Oak's lead safeguarding officer. In this session, we're going to explore Woodcraft Oak's staggered approach to reopening groups. What we're proposing is that we can't go from lockdown to having our usual group meetings in school halls and community centres as we had done back in March, February, January and the last 95 years. So we'll talk about what that looks like. I'll also go through and identify some of the risks and how we're going to manage them, and importantly share what support and resources are going to be available. It's really important that as a whole movement we use the skills and the knowledge and the experience of all of our members to make sure that we're all learning as best we can and making sure that we're managing the risks where possible for our volunteers, children, young people and their families. I don't want anybody to feel that they're making this up as they go along. I want us to work together and make sure we're supporting each other and that it'll be right for each group as we go forward. So very basically, I keep saying these principles over and over again. All of our activity must comply with government guidance. Now, government guidance at times has been less than clear. It is also true to say that government guidance is different in Scotland, England and Wales, which does make it a little bit complicated. But it is important that we comply with it, otherwise we will not be insured, and importantly, we may be breaking the law. All volunteers need to be happy with the decision to reopen. I don't want any volunteer to find themselves in a situation where they feel uncomfortable or pressured to do something that they don't feel is right for them, their group or their community. A risk assessment must be completed for the venue, activity and infection management before the activity takes place. This must be written down and shared with all the volunteers and available for any parents or young people who wish to see it. I will be preparing standard template risk assessments that cover infection management, and it will be important that each individual groups add to those about the issues and the risks associated to their venue and the activity that they are planning. Clearly, sitting in Leicestershire, I can't identify the risks of the group in Edinburgh or Cardiff or Exeter or anywhere else. It's also really important that we start with outdoor socially distanced meetings. We could wait and be in a position to move straight to indoor meetings, but I feel that many of our children, people and families want to begin to feel connected back to the movement, and therefore, if possible, we're encouraging groups to consider doing outdoor socially distanced meetings. For our younger wood chip and elfin groups, we are recommending that people consider doing these on a household and family group basis to reduce the demand and risk on individual volunteers, so that volunteers will need to coordinate family and household groups rather than provide direct care, instruction and supervision to children themselves. I am aware that this really only works for our younger members, and there will be nothing wrong with people making the decision that we can move to group, i.e. young people only activities for our venturers or for maybe some of our pioneer groups. But I will leave that decision to each local group and district. What's really important is also that we follow sector guidance. Now, yesterday in England, the National Youth Agency published the sector guidance for all youth work organisations, and that has been developed with the Department for Culture, Media and Sport, Department for Education, Public Health England and the Health and Safety Council. I just want to share a little film that they've produced, which we will hopefully give you a view. If I can, oh, that's, oh, let me press go. Service for young people. Okay, I got the message that you couldn't hear the film. Sorry, I was obviously pushing the broadband levels just too much. I will. The link is here, and I will share this recording and the link and the guidance separately so you can see. What it basically says is that they, as the youth sector statutory body, will give an announcement about the readiness level to begin youth work, and that we as a youth organisation will need to follow that readiness level. Now, this is the National Youth Agency that gives guidance for youth work in England only, and I'm expecting the bodies in Scotland and Wales to follow the NYA with similar guidance in the next couple of days or weeks. What they have said at the moment is that our readiness level is red, and that we can only do online and digital youth work. We can do detached youth work, which is something that Woodcroft Folk doesn't do, or one-to-one sessions with high need or vulnerable young people, as long as they're outdoors. Again, one-to-one sessions is not something that Woodcroft Folk does. We do group activities. Therefore, whilst the readiness level is red, Woodcroft Folk activities cannot take place without either being online or remote, as we have been doing for the last 3 months. What their readiness levels mean is that they have 4 readiness levels. We're currently on red. The next level is amber, and at the point when we get an amber readiness level, we can start to do outdoor group activities or small groups of young people indoors. Now, the definition of small groups is 15, and it just so happens that the average size of a Woodcroft Folk group is 15. So if your group is average, you could actually move to be indoors. Our recommendation at this time, however, is that we start and stick with outdoors, as the risk is much lower. When the readiness level moves to yellow, they're saying we can start to do trips and activities. 15 young people, just 15 young people. So that would be, depending on what age group, that might be 18 of you in total, 15 elfins and 3 leaders. When it gets to green, they're saying that overnight stays at residential centres, international trips can begin. The NYA hasn't yet predicted when these activities, what dates will go with the amber, yellow and green recommendations. In the roadmap to reopening on the 8th of June, Woodcroft Folk trustees agreed that we would start our activities when cultural and social activities were permitted, so when sports and leisure industry begins. We're expecting that announcement to be later this month for England and possibly the middle of July for Scotland. I am less clear about when that will be for Wales, but we're expecting it to be imminent, and therefore we need to start planning about what we feel comfortable to doing and whether or not we wish to begin activities before the start of the autumn term. Following the NYA's guidance yesterday, I have updated our roadmap and therefore will be issuing tomorrow an updated roadmap which includes this red, amber, yellow, green readiness levels. I will be sharing it with the recording of this webinar and a link to that film so you can watch it, because the film is actually quite useful to explain what the readiness levels mean. I think what's really important, and I want you all to take away from this is that one size does not fit all. We need to make sure that whatever decisions we make to reopen take into consideration what's happening in terms of coronavirus in our local area. And there will be different choices for the different age groups. It is quite clear that pioneers appear to be engaging well with our online programme, and we may not wish to change that. There is also an acceptance that many of our venturers are beginning to socialise anyway, and therefore they may benefit from coming together in some sort of programme activity. We will also need to take in consideration what's happening with our local venues and the capacity and the support needs of our volunteers. There is nothing wrong with making the decision to delay reopening. It is much better to delay and for everybody to be comfortable with that decision than rush and find ourselves in a situation where we can't manage the risk that is in front of us. We're also very aware, if we've been following the news, that local conditions of coronavirus are very, very different across the UK, and therefore in some areas the risk is much, much lower. And I can help direct you to statistics where you can figure out where you are in your locality. Now let me just check if there are any more comments. Okay, so that was Johnny. So yes. So if you were looking for Woodcraft Folk guidance, you can find it at woodcraft.org.uk/COVID-19. There is all of our historic guidance that we've been issuing since the 1st of March, and you will find, not today but tomorrow, the updated guidance that has been written today following the NYA publication. So, I know everybody wants to know when can we open. I have to stress, currently is not permitted anywhere in the UK. Currently in England, groups of 6 people can meet outdoors, socially distanced. But from a woodcraft point of view, that would be 2 leaders and only 4 children. And that doesn't feel very woodcrafty and doesn't feel like it's a group. And therefore, our recommendation is to wait until sports, leisure, culture and social activities can open. We predict that will happen early next month. And I need to say again, activities should only take place when there is a risk assessment and that's been completed and the actions in it actually actioned rather than just written on the spreadsheet and saved. Sorry. We have prepared risk assessments for a range of type of activities. So we have prepared risk assessments for outdoor household socially distanced activities, those outdoor activities that don't involve parents but just involve children and young people and our volunteers, indoor activities which are socially distanced, and we will prepare activities, risk assessments that aren't socially distanced. We haven't prepared those yet because currently we do not know when the social distance requirements will be reduced. Social distancing for many of us feels very difficult, and over the next couple of weeks we will see what the impact of lockdown easing has on people's attitudes, people's anxiety, as well as infection levels. And people keep asking, what about camping? As I said earlier, centres will welcome household and family groups, possibly from the 4th of July, which is when we're expecting public campsites to open. We will not be welcoming woodcraft folk groups to camp. And we just need to wait until all of our volunteers, children, people and families are ready to go on a residential or to go camping. I feel that we need to be cautious and that we need to rebuild our relationships and confidence in each other and our safeguards. And therefore, what we're recommending at the moment is that you shouldn't begin to even think about planning a residential until you've had at least 4 weeks of safe, supportive activities together. At this moment in time, my crystal ball suggests that we may be doing small scale, i.e. just one group and their supporting leaders, residentials, possibly from October half term. However, it is highly likely that we may see an increase in cases as we go into the winter. if this virus behaves as other cold and flu viruses, and therefore it may be that those events would need to be cancelled, and that we may want to preserve our energies and plan for the longer term, and maybe not schedule residentials until the spring or summer term 2021, which I recognise is a very long way away. And I've had lots of conversations with people about risk management and camping. So whilst camping is outdoors, which we all recognise is lower risk, camping also increases our risk because hygiene levels are often lower. We also know that when we camp, when you share a tent with somebody, you cannot be 2 metres away from them. So until that rule is amended, we are unlikely to be camping in the short term. As groups of districts at this point, in planning to reopen, my recommendation is that you host a meeting of your volunteers to discuss ideas and concerns, and that you make contact with your usual venue. It may be that your usual venue is already open and is keen to welcome groups back. It may be that your usual venue is reluctant to welcome groups back, particularly if they're having to do additional cleaning. What's really important is to find out their strategy for managing coronavirus risk within their premises, so that we can make sure that we're adhering to that. What's also really important is effective communication with our children, young people and their families. Talking to them about what it is that they want, when, where, how often, would they rather wait? Are they quite happy to continue with remote and virtual activities and prefer to wait until later, or are they desperate to have some social contact with others? There are many groups and districts who are considering planning outside walks and hikes as a way to introduce people back to each other, and that feels quite a low risk opportunity. There should be no physical contact games. You're outdoors, and families are self-sufficient in terms of their picnic and the equipment that they need to participate. It might be a start. There are key risks to be managed. The first one is around infection and contamination risk, as well as our risk to our volunteers, children, people, families, and our reputation. We need to make sure that we are taking serious our responsibilities of duty of care to the children and people that we look after. In terms of managing that infection risk, all the guidance suggests that we need to increase the level of hand washing and good personal hygiene, which we can do through using soap, water, hand sanitizers. The advice is that we do that on arrival at any group activity and as people depart. The advice is also that we don't need to have PPE if we are outside doing socially distanced activities, and that PPE is unnecessary because being outdoors and socially distanced is enough to reduce the risk of contamination and infection. The advice and guidance is that we need to make sure that we manage group numbers and therefore, if possible, arrange bookings, that we stagger people's arrival times so that they don't all arrive at the same time, that we are really clear with our instructions about what people should expect, that we have signage around about hand washing, about social distancing, and that we remind people constantly of this need. What's also really important is that we have a procedure in place to deal with anybody who may demonstrate symptoms whilst they're with us. Now, clearly, if we're outdoors and doing a family activity, you simply send that individual home with their family the moment they start demonstrating symptoms. If you're on a residential with an individual, it's far more complex, but there is guidance in the roadmap document about what we should do, and it's in those circumstances the volunteer who is looking after that child or other adult would need to have PPE. So we need to have a little stash in case we need to do first aid or provide support to somebody who has symptoms. But in most cases, if we were meeting in the park for an hour, that would not be an issue. The other thing that we need to manage is the risk to people, and consider how we can be inclusive of all of our volunteers, children, and people, including those who have medical conditions that puts them at significant risk. We also need to make sure that all of our members, young, old, and volunteers, understand and commit to the new ways that we need to work with each other. It is very clear that if we're doing social distancing, no group hugs, and that we need to make sure that we have sufficient supervision levels to remind people on a regular basis of the 2-metre rule. I have drafted risk assessment templates, which I will circulate to group leaders tomorrow. And if anybody wishes to get any additional feedback on that, I'm more than happy to go through that. But I don't feel on a webinar going through a risk assessment spreadsheet is the most engaging. But if people have read those and have questions, I'm more than happy to answer them. In terms of, I think I've just answered that most of that. So in terms of managing the risk assessments are key. Booking, we think, is essential so that you know exactly how many children and people are coming. It's going to be really important that we keep a register of all participants, because if anybody did develop symptoms, we would need to get in contact with people and ask them to isolate until the case had either been confirmed as positive or negative. I've already said about staggering arrival times, providing hand washing facilities, and at least for a short while, not having shared equipment. So being creative about the games that we play. Now, there are many people who, football coaching has begun, who are playing football, but trying not to touch the ball, or doing so only with gloves. The best way of managing this at this moment in time is to focus on outdoor activities. And whilst today has been a little wet, we've been very lucky with the weather so far, and hopefully that will continue and enable us to meet in July or August. There are some challenges, and they're less about managing the risk, but managing relationships. And I think it's really important that we engage with members of all ages in making the decisions about when and how we reopen. I said earlier that we need to be inclusive of all of those people, including those with health conditions or those who are at higher risk for coronavirus than others. And in the updated roadmap to reopening, I've included some definitions of who is at higher risk, as well as who maybe have underlying health conditions that we would need to consider, including any expectant parents. The other thing which I think is actually really difficult is supporting those with anxiety and those who have concerns about going from complete lockdown to being involved in a group activity again. And that, I think, we'll need to be careful and take very gentle steps, as well as issue lots of guidance and reassurance and communicate effectively with them how we're managing any risk and what they can do to help safeguard themselves. People's attitude to social distancing is also something that we're going to have to manage, but for the time being, it's something that we're going to have to commit to maintaining. It will be a requirement of our insurance, and it will be a requirement of our risk assessments until the government guidance says we no longer need to do that. The other challenge that we're going to have to overcome is access to training. Now, Woodcraft Folk and Folk Office will provide a series of guidance films and other webinars to help make sure that everybody understands what they need to do in terms of infection control, in terms of quarantine, in terms of risk assessment. And I'm finding that access to PPE, affordable PPE, is turning out to be a challenge. But we are collating places where people can purchase that for their groups if they feel that there is a need to do so. We also have a collection of PDFs, which I'm about to share with you, that things are about reminding people to wash their hands, reminding people to stay 2 meters apart, as well as saying that we are following the National Youth Agency guidance and that people should have faith in the measures that we've taken to manage risk and that what we're doing is following government guidance. So what support will be available to you? The Dream Big at Home team will publish activity plans. They're currently writing socially distanced activity plans. These currently aren't live on the website because you currently can't do them. But as soon as we have a date where we can be confident that our groups can begin to meet outdoor socially distanced, we will publish them and tell you that they're there available for you to download. We're also arranging training in bereavement support, infection control, risk management, and how to facilitate socially distanced activities. I'm quite keen to listen to what you think your support and information needs are, and we will do our best to address them. The other thing that we have, as I said, is example risk assessments. Now, these risk assessments only focus on the risk of coronavirus, so you will need to add to them about your venue risks, about your activity risks, any equipment risks, as well as any risks to do with the individuals who are participating in your activities. The other thing that we'll be doing is facilitating meetings for groups and districts by region and by age, so that you can share practice and share your concerns about how would you manage social distancing with wood chips, or any ideas for how to do activities for venturers. Becky, do you want to say that out loud, Becky, if I just unmute you? Let me see if I can. Oh, you've unmuted yourself. Go for it.
I have an Elfin who I've developed a great relationship with, but he's definitely somewhere on the autism spectrum, and he loves hugging me regularly during sessions, and it's that his parents really are quite amazed about this relationship. So it'd be great for socially for our group to reopen, but obviously social distancing could be quite damaging to that relationship if I insist that he cannot hug me. And obviously autism obviously just adds to that kind of social challenge. So I was just wondering, any thoughts on this? Do we just simply delay opening? Are there ways we can manage it?
I mean, a risk assessment is an assessment of risk. You're never going to eliminate all risk. And therefore, you need to find a way where you are comfortable with the risk. As a general rule, we need to follow the guidance. If there is greater benefit to not following the guidance, or increased risk to the child by following the guidance, then we need to be pragmatic in the decisions that we make. If you and other people don't feel comfortable with the support needs of that individual, then you should delay opening. If you, that child and their parents, recognise that there is a highly likelihood that the individual will come and hug you, and that you're happy with that, particularly if the individual has washed their hands and is obviously demonstrating perfect hygiene, then that may be okay. Or you might decide that actually, if we both wear PPE aprons, we can hug, because that's managing the risk. Do you understand what I mean? As in,
yeah, I understand it. Yeah, that's good. Good to know that it's not so strict that conversations can. I was about to say blur boundaries, but yeah, manage it effectively.
I think that one of the challenging things is that there is really clear guidance, but if you are working with very young children, so if you are working in a children's nursery, you couldn't be 2 meters away from a small child, because you'd need to get closer to give them care. So if breaking the guidance is in the best interest of the child, then that's the right thing to do. So we need to do that risk-benefit analysis, which is a posh way of just making a judgment about what's the right thing for that individual.
Yeah, that makes sense.
Okay.
Yeah.
But I'm not going to say here and go, we should hug every child, because clearly that may spread and further contamination between the whole group.
Yeah.
But you don't want somebody to feel like they've been isolated, or they're not worthy, or they're not wanted anymore, or any other negative emotional thoughts because the nature of your relationship has changed.
Yeah, that makes a lot of sense.
Cool.
Thanks, Debs.
That was a little pop-up in the thing about just talk to their parents, right? Absolutely. Have the conversation. And if the parents are happy, that you're happy and the child's happy, then that's the right thing to do. And you can go, the way we're going to manage that is that we're going to come, both of us, with clean clothes. We're going to definitely not hug until we've sanitised our hands on arrival. And if we are a bit cautious about it, then we can introduce aprons, or you could even decide that you're actually going to do it with a mask. And therefore, you know, whilst the evidence on masks and face coverings is still being debated, common sense suggests that the masks prevent you spreading coronavirus to other people. So if that was the possible, and that individual wouldn't be too freaked out by a mask, that might be another way of managing the risk. Okay? Cool.
Yeah, thank you.
Thank you, Becky, for the question. And the other thing I said we're going to do is lots of signage to remind you and everybody else what the rules are. It seems, if anybody's been following the government over the last few weeks, that guidance is changing very quickly. And this may only be for a short while, or we may still be following this guidance for several months. And at this moment in time, nobody really knows. I am particularly interested in your questions and your concerns, or any comments that you have. There are quite a few of us on here, so I don't want to unmute you all at the same time, but if there's anybody who wants to talk about the conversations they've been having in their group and district and share that with everybody else, I would welcome you to just pop your name in the chat and I can unmute you. But just while I'm waiting for somebody to volunteer, let me just confirm that currently, at this moment in time, physical face-to-face woodcraft activities cannot take place. We are expecting an announcement in the next couple of weeks that will permit sport, leisure, social and cultural activities. At that point, we can begin to do outdoor activities. And we are recommending that we do at least a month of outdoor activities before we choose to go indoors, and that we do a month of indoor activities before we choose to go and begin to plan a residential. My recommendation is to be cautious and make sure that you consider the capacity of the volunteer team. One of the things that was mentioned at the very beginning of coronavirus is that if you do have an infection within your group, it could quite possibly take out all of your key volunteers at any one time, and therefore you don't want to be in a position where you have a residential and not enough volunteers to make it happen, and that we'd rather do something on the safe side and continue with remote and virtual activities than have to cancel activities and disappoint children and people further who've already had their Easter camps, their May camps and their international camp postponed. Is there anybody who would like to either share their thoughts or their concerns or the conversations they've been having in their district?
Unmuted.
Oh, sorry. Should I just unmute and ask? I've been trying to type.
Go for it.
Yeah, so just interested in that idea of sort of children who may have people in their family who are vulnerable or might be vulnerable themselves, how we keep them included as we begin to bring people back together.
Thank you, Rachel, for asking that. I think there are various different definitions about vulnerable. There are those who have medical conditions that are clinically vulnerable, and there are definitions of those who are extremely clinically vulnerable. Currently, the extremely clinically vulnerable are still told to isolate, where others are now back in circulation, and some of them are even permitted to attend schools and other activities. What I think is best practice is that we need to have conversations with those families about what they're comfortable doing, and that we consider developing an activity plan that is inclusive of them at a level that they feel comfortable doing. And that may be that we do activities outdoors that are the same activity but very spread out. So one of the lovely examples during lockdown was a walking tour of Hackney, which was organised, where households visited, I think, 10 different locations to get a treat. So all of the families were given a different starting location. They were given a different start time, and therefore they rotated, not seeing each other, but doing the same thing at roughly the same time, leaving chalk messages to each other, and that they ended that trip collecting all the ingredients for the same meal, which some of them then joined each other on Zoom to cook and then eat. So there was a huge sense of connection without any risk of contamination. Now, you can only do that so many times before people want a change, but it might be a nice, gentle way to begin to introduce that sense of belonging and group. And then maybe next follow that up with a scavenger hunt, widely dispersed in a public place. And then maybe a hike or a walk, making sure that we are being mindful of distances before we then maybe do challenges or games in a public open space. Does that make sense, Rachel?
I mean, did. Yeah.
Yeah. It's very difficult. It's very difficult. Oh, I'm sorry. I'm going to have to mute you again because I'm echoing through you, Rachel. As an organisation, we don't want to exclude anybody, and we don't want to exclude anybody who may have been having increased concerns and anxieties as a result of coronavirus because of a pre-existing health condition. And therefore, I think it's all about how we communicate with people and how we plan, and that we're collecting as much best practice from across the sector and learning as other people test things. Now, there's another question come up here. Jenny, I'm going to unmute you. You can ask us all rather than me read that. Jenny, I've unmuted you, but you've muted yourself. So if you unmute, you can ask your question.
Yeah, I'm wondering about the practicalities of first aid while we're running these socially distanced events, and whether that's something that we're expected to cover, in which case presumably we do need PPE for that.
Sorry, I've just muted you, sorry. Jenny, yes, if we're giving first aid, the recommendation is that you have PPE. So if you were organising an outdoor activity, you need to take along your first aid kit, you need to make sure that you've taken along gloves, you need to make sure that you've taken on a mask. If you believe that there is a risk that the individual is going to cough on you or put other saliva or body fluids on you, then we're advising that you also have a face screen. So that you will find that guidance in the roadmap with a list. So it means that we need to add to the first aid kits that we currently carry with us. They should always have gloves in them anyway. Some of them may already have aprons in them, but they're unlikely to have masks and screens. So we would advise you to purchase those in case that they're needed. Does that answer your question, Jenny?
I think so, yes. I mean, the other option was, does it fall foul of our not sharing equipment if I just hand the parent the first aid kit and run away?
I mean, that is an option, but then you have shared equipment. There is less risk to you sharing that equipment than giving first aid to their child. But if you're using proper PPE, then your risk to you is quite low. It depends on how comfortable the parent is administering to their child and how much first aid is actually needed. I mean, sometimes it's just a bit of TLC rather than full first aid.
Yes. I think I would probably just fling a plaster in their general direction if that was all that was needed.
If all they needed was a bit of a wash and a plaster to make them feel better, then by all means let the parent take responsibility for that. If it's more than that, then somebody who has some first aid competence is probably better dealing with it than the parents taking responsibility. Does that help?
I think so. I mean, it's part of a general difference between running as a group, when it's quite clear that we've got leaders where that responsibility and crossover between parents and leaders starts and ends, that we're going to have to start navigating when we have all the parents there.
Yes. And I've had conversations with some groups who feel that navigating and managing parents is just too much of a challenge, and that they'd rather just deal with the children and people. And if that's the decision of your group in your district, then there'll be nothing stopping you doing that as soon as social and leisure cultural activities are permitted. But we feel, particularly for our younger groups, that it may just be easier to manage the children if they are being supervised and managed by their parents rather than by their leaders. It is difficult that parents may actually be harder to manage than the children on their own. I think it depends how you go. Now, Emily's making some comments. Emily, I'm going to unmute you and then you can make them out loud to everybody. Emily, there you are. If you unmute yourself, we'll be able to hear you.
Hi there. Yes, I was just thinking, I run an elfin group, and I know that for most parents, if they were able to come to a family-based session outdoors, they probably have to bring other siblings. Often those are younger siblings, in my group at least. So, you know, we have to then plan to make sure the activity will work for those children, and just think about, you know, I have 20 elfins, so then potentially I've got 60 people rather than 20 people. So it's just an extra consideration.
And it's about making, as I said earlier, about making the right choices for you, because one size is not going to fit all of our groups, because our groups are so varied. Some of our elfin groups have more than 30 children in them, and some of them only have 8. So we need to do that assessment about what we're comfortable with and what's going to work for our communities. Clearly, if there is transport needed, it's probably easier to engage the parents so that they can do that transport. If actually you're all within a couple of streets of each other and people can walk, maybe there's less of a need to involve parents. If you're getting large numbers, then the type of activities needs to be very carefully planned to make sure that you can maintain social distancing. Doing games in the park with 60 people, I would imagine, would be very, very difficult to sustain 2 meters from each household group. But that maybe is the right number to go on a country hike. If you want to talk about it anymore, Emily, I'm more than happy to have a conversation with you at another time. Is there anybody else who'd like... Oh, God, thank you, Emily. Anybody else who'd like to comment or ask a question, or has a suggestion about what information and support needs or training they feel that they need before they're ready to reopen?
Unmuted. Can I ask for a clarification on the on the first aid thing? So if we're going out, well, if we're doing anything with the children, it sounds like we're going to need that visor in case we have to do full-on first aid, basically. So we will have to. Okay, so it's just to clarify that. And then I do have a question on managing the 2 meters with the children. I mean, watching adults, even when there's only 6 of you, that 2 meters is every so often breached, because people don't really have a sense, and then they forget and they pass each other, whatever. And I'm just wondering, I mean, my inclination would be to just gently, you say, oh, look, don't forget, we've got to keep the distancing. But I don't think I'd be comfortable in a situation where I felt like I had to try and keep the children 2 meters apart at all times, because there would be breaches.
I think breaches are inevitable. Many of us don't have the spatial awareness to know what 2 meters is I keep telling people it's the length of your bed, which is quite long. So I think we need to be pragmatic, and if we put up the signage, if we tell people in advance, we tell them on arrival, and we remind them regularly, and if we see a huddle, we try and intervene and go, please remember, we're trying to keep each other safe. Some suggestions in the roadmap is about mapping out spots in the same way that they're using in schools for activities to happen here, here or here. Emily, do you want to share that comment with the rest of the group?
I think you just said the same thing as I typed it, but obviously schools have had children in all this time with the key worker children, and perhaps we can draw on school teachers' experience and other school staff, how they found that difficulty with social distancing and some ways of managing it.
I think it's going to be impossible to always be 2 meters, but I think if we can try and make sure that if people are following good hygiene, that they have cleaned their hands on arrival, that we're doing our best to keep them socially distanced, that we're not swapping equipment between individual children, and that our activities are outdoors, and that they're for a short period of time, we need to make sure that we are being realistic in how we're managing that risk. You know, we're not asking them to be inside for 6-7 hours, but we are outside maybe for an hour, maybe an hour and a half, which reduces the risk. Jenny's asking, does anybody have any good suggestions for outdoor hand washing? It's really hard, and the best way, the only suggestion that I have, if you don't have access to hot running water and soap, is that we have to use hand sanitizer gel. It's unlikely that you're going to be able to travel around with an automatic sanitizing pump, but squeezy bottles that you can squeeze into people's hands, which clearly means you're going to have to be closer for 2 meters than them to squeeze it, is the best suggestion that I've got, unless you are immediately outside a building and you can do buckets of water, but that's an awful lot of buckets because you don't want people to keep using the same soap. So squeezy hand gels or squeeze it or wipes is my only suggestion. If somebody's got a better suggestion, I'd love to hear it.
Well, I mean, the only thought I had was sort of sending people a kit list and reminding them to bring their own damp flannels, 1 per person, use it, put it in a bag, take it home. But no, I haven't got a good idea, really.
I mean, in buildings, you can have automatic dispensers outside. So as they enter, they can hand sanitize. In the woods or a public park, that is much, much harder. You can get some that are freestanding from the floor, but I just don't think it's realistic or cost effective for our groups to use one of those. So we can ask people to come with their own hand sanitizer, although I think it probably is better for us to be squeezing and supervising the hand sanitizing as people arrive. Okay.
Yep.
Anybody else have any questions or comments? And remember, I'm really keen to hear your requests for any information and advice. I'm quite confident that you're all going to welcome sessions plans and risk assessments, but if there's something that we've forgotten that you think would be really helpful, please do share. What we have produced for our centres is cost-effective PPE places where you can purchase it. So we can share those shopping links around the movement so that if you need to buy aprons, gloves, screens and masks, you can do those. The ones that we have identified for our centres are arranging delivery in a couple of weeks. There are cheaper options if we are willing to wait 4 to 6 weeks. But I can share those with our groups if you think that would be helpful. I see a yes, please. So I will share those. Elaine's just saying here that supermarkets have hand sanitizer dispensers on a table which is supervised. So maybe that's something we can do. Is I'm aware my local co-op has a table with hand sanitizer, and somebody stands in the rough vicinity to make sure that we've all sanitized our hands as we go in, or at least they did at the beginning of lockdown. Johnny, do you want to say that out loud? I've unmuted you so you can unmute yourself and speak.
Yes, yeah. So my question is, if we start organising walks and things like that, as this is more for a group than as family groups, at what point could we or should we recommend people can travel somewhere by public transport, especially if you're going on a hike that's going from A to B rather than a circular walk? You don't necessarily want people even driving to one point and then having to redo the hike back again. Public transport is always the kind of go-to recommendation, or had been previously, and it's becoming much less and less an acceptable thing to recommend even now. So I wonder what your thoughts were.
I mean, it's a really difficult issue, because clearly public transport is there. The requirement to wear face masks or face coverings on public transport is now current in England, and it's recommended in Scotland and Wales. If I was planning, I would try and plan an activity that didn't require public transport or car sharing. But I do recognise I live in rural Leicestershire, and therefore going for a walk on footpaths is probably easier for me than it may be for you, Johnny. So I would think if you could organise maybe a penny hike or an urban hike rather than one that required transport. I don't know when we'll be in a position to recommend carpooling, but at this moment in time, I don't feel very comfortable with that as a recommendation.
Sure. Okay.
I recognise I didn't really answer that question, but I think we should try and
sorry. I mean,
avoid it for now.
I mean, even 3 out of, as you know, all of our volunteers for our group would have to use public transport, I think, to get across London or to get to our sessions to start them. So again, we've got, it's tricky when you're not necessarily as local to your group as that, if that makes sense.
It does make sense, and that's where I recognise that all of our groups are going to open at different stages, because we're going to have to make the risk assessment based on the individual circumstances of the volunteers, the group, the venues, and our locations. And that if public transport is required, whilst there are no restrictions in using public transport, there are clearly increased risks of using public transport rather than your own transport or simply walking or cycling. And therefore we need to make sure that everybody's comfortable with that risk. It's something that will reduce as more and more children go back to school, depending on the age of the children, and start using public transport to get to their high schools. Then if they're using public transport for school, we're not increasing their risk by asking them to use public transport for Woodcraft Lake.
That's a good point. Okay.
Okay, thank you, Johnny. Anybody else have any questions or comments? I'm going to take silence. There's no questions at this time. If you have any questions, by all means, just email safeguarding@woodcraft.org.uk and I will do my best to answer them. Hopefully you will see the updated guidance tomorrow and we'll find the answers to your questions there. let me just remind you again, I'm sorry, that currently, as of the 18th of June, we cannot do face-to-face woodcraft folk activities in England, Scotland or Wales. We are expecting announcements in late June that will enable us to do activities in England when they release social, cultural, sport and leisure activities. At this moment in time, we are expecting Scotland to be about 10 days behind us, and I do not have a date for Wales. I mean, I know that Adam is here in the call. Maybe Adam, do you have any local knowledge about what's going on in Wales? Adam.
Yeah, hi. I don't have any local knowledge. I'm really sorry. It occurred to me that I should have before I logged on to the meeting, and I just don't.
It's really interesting because each of the government offices are doing it very differently. So Northern Ireland has been very clear from the very beginning what dates it's doing everything. England have been a bit vague, but they have at least given dates. And Scotland and Wales are playing things much closer to their chests and not trying to give out dates when circumstances may change. Now, clearly, I have the expectation that England will make its announcement later this month. It may not, and it has said that the 5 government tests will need to be met before they release and ease lockdown further. So we will have to wait and see. But at this moment in time, we're expecting us to be able to do activities in July if we do them outdoors and socially distanced in England, and that by the end of July we'll be able to do the same in Scotland, again outdoors and socially distanced only. As soon as those readiness levels are announced, I will share them with our groups and districts and on our website. But now's the time to start having conversations. So Adam's just shared that one of their volunteers needs to shield until the 14th of August. So maybe that's an easing that is being predicted. What we obviously don't know is if there will be further restrictions introduced in the autumn or winter, if there are other waves that put the R rate above a level that is acceptable. And therefore we may have to revisit this conversation. Woodcraft Folk will continue to deliver online and remote programme activities through Dream Big at Home, and I've been really pleased and excited to hear how many groups and districts have been delivering virtual programme and maintaining content and communication with their young members. So thank you everybody who's been putting efforts into that. I know we've all learned new skills and tried new things. So if there are no more questions, I will say good night to you all and tell you to look out in your inbox tomorrow for updated guidance on the roadmap to reopening, this recording and the link to the National Youth Agency film about the readiness levels that we're going to have to follow in England. So thank you everybody. I'm going to say good night. Enjoy the rest of your Thursday evening and I hope you have a lovely weekend. Good night all.